Every year at Congregation, UBC has the honor of bestowing honorary degrees upon individuals who, in the opinion of the university community, have fit the criteria of excellence and eminence in their chosen field. Jeffrey P. Koplan is one of those individuals, and I invite him to step forward to receive his honorary degree.
Dr. Jeffrey Koplan, you are an internationally renowned public health leader, scholar, and professor, and Vice President for Global Health at Emory University in Atlanta. A 26-year veteran and former director of the U.S. Centers for Disease Control and Prevention. Dr. Koplan, you began your public health career in the early 70s as a member of the CDC's Epidemic Intelligence Service. You have worked on a wide range of major public health issues, including infectious diseases such as smallpox, SARS, pandemic influenza, and HIV/AIDS, environmental issues such as the Bhopal chemical disaster, and the health toll of tobacco and chronic diseases. Your work has impacted people around the world. You have pursued numerous collaborative initiatives in China, and since 1980 have made more than 50 visits on projects for the World Bank, the World Health Organization, the CDC, and China's Ministry of Health. You've played an active role in the design of the Chinese public health system, including the creation of the China Center of Disease Control, contributions for which you have received the 2013 Friendship Award, China's highest honor for a non-citizen. You graduated from Yale University, and I know you're proud of that, the Mount Sinai School of Medicine, and the Harvard School of Public Health. A board-certified physician in internal medicine and preventative medicine, a master of the American College of Physicians, and a member of the United States National Academy of Medicine. You've been a co-founder of the International Association of National Public Health Institutes, have served on numerous advisory groups in the U.S. and abroad, and has written more than 230 scientific papers.
Mr. Vice Chancellor, in recognition of extraordinary contributions to humankind and to public health education and research, I ask you to confer the degree Doctor of Science or Honoris Causa upon Jeffrey Powell Koplan.
By the authority of the Senate of this university, I confer upon you, Jeffrey P. Koplan, the title and degree Doctor of Science, honoris causa. Ladies and gentlemen, Dr. Koplan.
Gives me great pleasure now to ask Dr. Koplan to say a few words.
President and Vice President Ono, Provost Seri, Deans Kelleher, Averill, and Porter, and honored guests, students, and families, good afternoon. It's an honor, yes. It's an honor and privilege to be with you for this commencement ceremony and to receive an honorary degree from the University of British Columbia. This is my second visit to UBC. My first visit was in 1984 when I came for a scientific meeting and brought my family with me. We stayed in a dormitory on campus, a much reduced campus from what we see now, delighted in the culinary offerings on and off campus, the spotless, easy accessible outdoor swimming pool that was here at the time, and the informative, interesting First Nations sculptures and other works at the UBC Museum. My daughter then, age 7, enjoyed our visit so much that she announced that UBC was the university she planned to attend. I suspect an added attraction was it seemed to be a healthy distance away from Atlanta, encouraging her already significant pursuit of independence. A decade later, her academic path strayed from Canadian Pacific to the U.S. Northeast, but my entire family have nothing but pleasant memories of and affection for UBC. It's a privilege and honor to be an honorary degree recipient from UBC. UBC is a great university with a strong embrace of global interconnectivity and perspectives. The award is further enhanced by having an old friend and respected colleague as university president and making many new friends here today, and I look forward to tomorrow as well. It's also by your having a wonderful faculty. And if I may, I'd like to extend a particular shout out to Professor Kai Chan for his leadership in the recently released report on climate change and its impact on biodiversity. And most importantly on this day, my award is further enhanced by sharing honors with the class of 2019, which I have no doubt is the best graduating class to have ever walked UBC's hallowed halls. Now, please permit me to ruminate for a bit on the concept of truth. I will begin with a very real but very tough truth, at least for me. You are all statistically likely to forget the majority of my speech within the week, maybe sooner. It would also be true to say that this insight doesn't stop graduation speakers everywhere, so let's continue. All you graduates, whatever your field of study, have devoted considerable effort to a quest for truth, whether that truth be the nature of love in Shakespeare's sonnets, identifying an unknown substance in organic chemistry lab, or considering the level of success of a particular governmental policy or program in a political science class. May I suggest that the pursuit of and recognition of truth be an ongoing quest for you after you receive your degree from UBC and move on to your professional and personal lives. Truth includes facts, evidence, objective observation, and the assessment of relative risks and benefits. Absolute truth is elusive, but worth making the effort to approach more closely. One can seek truth in the sciences and in the humanities, and these truths can be applied to our personal lives, the decisions we make at work, and the decisions that governments make when establishing policies and passing laws. My earliest memory of wrestling with the accuracy of an authority figure involved listening critically to advice from my grandmother It prepared me for a career of differentiating truth and science from non-truth and fake science. My grandmother, a self-taught guru of health promotion, had several warnings for me. Don't swim within a half hour of eating or you'll get a cramp and drown. I still think of that when I go to the pool. When did I last eat? You know, maybe it could happen there. Don't ever sweat, even while exercising. And if at all possible, don't exercise or you'll get pneumonia and die. And thirdly, overweight is healthy, and being awake is reason enough to eat. Don't wait for being hungry or mealtime. There have been many such false concepts that seem like jokes to us now. Bloodletting is therapy, the earth is flat, creationism versus evolution. Some such false concepts, when held and promulgated by the odd national leader, are not humorous at all, such as the rejection of the considerable body of evidence that documents climate change. Unfortunately, too frequently truth, evidence, and facts are ignored, or worse, attacked. This has been happening in one area of public health for the past several years. In 2019, there have been over 700 cases of measles in the United States and 41 cases in Canada. While Canada is clearly doing a better job than the US, there still should be no cases in either country. Measles is a highly contagious, serious illness. It's not like getting the common cold. It has serious short-term and long-term complications, including death. The good news is that measles is an eradicable disease. The measles vaccine is extraordinarily effective, 97% effective, and extraordinarily safe, including the combination MMR vaccine, which also provides protection against rubella and mumps. In 1998, as director of the US CDC, I traveled to Washington, D.C. to sign a letter of commitment with Sir George Alene, the Director General of the Pan American Health Organization, to eliminate measles from the Western Hemisphere. With aggressive vaccination programs and widespread awareness campaigns, we made progress, and measles was declared eliminated from the U.S. in 2000. Nobody in the U.S. and Canada should be contracting the measles in 2019. But here we are, with close to 750 cases reported between our two countries. What went wrong between the year 2000 and today? One explanation offered is that because of the huge success of vaccinations, many younger people are simply not aware of the toll that now preventable infectious diseases takes on individuals, families, and communities. My generation saw this toll firsthand. I had measles. I had mumps, rubella, and chickenpox. I had schoolmates who had visual impairments and hearing loss because their mothers contracted rubella during their pregnancy. My neighbor, a woman across the street from where I lived, Mrs. Brava, disappeared one summer day during what was then referred to as polio season. She returned home several months later to her young family in a wheelchair. My summer camp banned all visitors all summer long to minimize the transmission of polio. My brother had polio. For those of you who like to combine scientific interest and humanities reading, for a vivid depiction of the truths of those pre-vaccine years, read Philip Roth's Nemesis, which I think is one of his best novels. Even my daughter, who I mentioned earlier, born in the late 1970s, had Haemophilus flu meningitis before the preventative vaccine was available. While I lived through the years that preventable infectious diseases were common, I've also lived through the years of steady vaccine development and implementation, which has continued throughout my public health career. And I can say without hesitation that every person in this room has benefited from the development and administration of vaccines. We have vaccines available to prevent measles, mumps, rubella, diphtheria, tetanus, pertussis, hepatitis A, hepatitis B, influenza, chickenpox, shingles, and human papillomavirus. And because of this, you don't have to worry about contracting these diseases if you are vaccinated. And if you are among the groups of people who are unable to receive vaccines, particularly newborns and people who are immunocompromised for any number of reasons, you still benefit because successful population vaccine programs create a herd immunity and affect communities. The printing press, air travel, landing people on the moon, the computer, the internet, and many of the technological advances mankind has made have improved our lives. But without vaccines, many of us would not be in this auditorium today. The access we have to safe and effective vaccines has been the greatest scientific advancement in human health that we've ever had, period. Vaccines have saved hundreds of millions of lives in every country represented here and in others around the world. As a physician and public health practitioner, I know it from the peer-reviewed medical journals that publish scientifically rigorous studies. And on a personal level, I see it in my everyday life. I don't have to worry about my grandchildren contracting polio at summer camp because they are vaccinated and because there is no polio season in North America anymore. But back to what went wrong. Why has there been decreasing vaccine coverage in high-income countries like ours? Why have there been over 740 cases of the measles in 2019? 4 factors play a role. While inadequate funding to purchase vaccine, poor distribution and access to vaccines, along with civil strife and government indifference, have contributed to low vaccine coverage in many low-income countries, the major impediments in North America have been due to what is politely termed vaccine hesitancy and anti-vaccination attitudes. Second, in the U.S., we rarely saw these once common infectious diseases, and because of this, some segments of the population simply stopped worrying about them or failed to recognize them as serious health threats. Out of sight, out of mind. An anti-vaccine movement arose and effectively disseminated, to use the current popular term, a lot of fake news, which in this case means incorrect, phony science, including an article published in a reputable scientific journal that was later retracted because there were so many flaws in the study. People seeking to find a cause for challenging health conditions in their families, such as autism, blamed the measles vaccine, but without scientific evidence. Some people found a religious basis for refusing vaccines. These parents, while wishing the best for their children, chose to follow advice devoid of scientific merit and also lacking theologic authority, and in so doing, increased a real risk to their children and their communities. And because of all these factors, measles is once again a serious health risk in North America. So aside from my public health, public service announcement, sorry about preaching to you, but I am at a podium and I do believe in public health, what is my takeaway message for you today? Firstly, when you are seeking information in any area or field, turn to reliable and truthful sources. The internet has been great in many ways, with instant access to a lot of useful information. However, you also have instant access to unreliable and false information. It can be very challenging identifying reputable, responsible sources of clear scientific information on the internet. To make matters worse, the advent of social media has brought an attractive delivery system for information and studies that lack real scientific vigor. The average person may not necessarily be able to tell the difference between a study that used shoddy methodology, weak analysis, and flawed data versus one that's a real scientifically valid study. Some parents prefer getting medical advice from defrocked doctors and grade B actors rather than a well-informed pediatrician. So for medical issues, where do you turn to for information? One is go to institutions that rely on wide bodies of literature based on scientific evidence. These include government agencies like the Public Health Agency of Canada, Health Canada, or the US CDC, UN agencies such as the World Health Organization or UNICEF, professional organizations, the Canadian Pediatric Society, the Canadian Public Health Association, and academic sites such as the Hospital for Sick Children in Toronto, which has an active site on vaccines. What do you look for when you go to pursue the evidence firsthand? Please note that conclusions based on one article or multiple articles from the same author should provoke skepticism. Look for information based on a body of literature with reinforcing findings from different authors with different affiliations. And apply the same standards to any field, issue, or concept that you are researching. You are very well educated and have been taught to think critically. Keep doing that. Be both lifelong learners and lifelong critical thinkers. You and your generation can and will make Canada, and I hope your neighbor to the south, and indeed the world, a better place by the thoughtful and community-concerned approach you take on key social issues and governmental policies, as well as the approach you take regarding personal decisions such as vaccinations. Many of you will be in government, community, and business leaders. Many of you will be parents. You will be responsible adults in every facet of your life. But as responsible adults, you will have influence, and to succeed in fulfilling those roles, you will need to find and use trusted resources for information and evidence and objective considerations of the pros and cons of an issue. You have to be able to think critically to do this. Use the education and training you've learned and earned at UBC to be lifelong critical thinkers in every aspect of your lives. Apply your critical thinking skills to identifying scoundrels and quacks. Use it when buying a car, assessing the health benefit claims of vitamins and other supplements, voting or not voting for a candidate who denies climate change, and yes, when making a decision to vaccinate yourself and your children against serious disease. So in summary, identify issues that require critical thinking, study the options, use trusted objective sources, be informed, don't confuse beliefs with evidence, and finally, here's a truth that I'm sure will seem self-evident. It's time to celebrate your accomplishments and successes with the people you love, especially today's accomplishment. Congratulations, class of 2019.